welcome back to Still Here podcast. And of course, I am your host, Precious Ochiagha. And we are back to having conversations that make you mentally aware, spiritually grounded, and emotionally strong. So if you are just joining us for the first time, make sure to click the subscribe button. Just take a millisecond to click the subscribe button, turn on post notification, and to stay in the loop, because we have so much back-to-back episodes coming for you and you do not want to miss any of that. So stay connected to us on Instagram, on TikTok at sh.podcast with a double T. Follow us, like, share, comment, just so that you are aware of everything. And you can find us on Spotify also. So welcome back. Still Here is just a conversations where we have people that look like me and look like you talk about situations and experiences they've had to go through. And of course, we have intentional guests as always. So I guess today is a medical doctor, a public health specialist, a mental health advocate, passionate about emotional well-being, healing, and resilience. He holds a global mental health certificate from the University of Washington and has led several counseling and mental health support programs focused on helping people navigate grief, emotional struggle, burnout, anxiety, and personal growth. Through his clinical work, public health experience, and advocacy, he is committed to creating safe spaces for honest conversations about mental health, faith, healing, and becoming. He believes deeply in the power of compassion, vulnerability, and human connection to help people remember that they are still here and their stories still matter. Can you see that? I said I'm intentional. Like, please help me welcome Dr. Ebuka Kennedy. The last name.
Okay. Should I help you with it?
Please do.
Anyachebelu.
Anyachebelu, yeah.
I got it, yeah.
And I'm an Igbo girl too.
You see, now the eyes are season watch, so I'm watching
you. How are you doing today?
Yeah, I'm cool. I'm alright.
How does it feel to be here?
Oh, to be honest,
I guess that.
I'm very happy to be here. I think for me, I've done like shows on mental health, but this is like the first podcast I'm having related to mental health. So this is a new experience for me, and I'm sure to be exciting.
We are so happy and privileged to be your debut.
Yeah, thank you.
While we're having a conversation before now, and we spoke once, and you told me how you also had to deal with your own mental health issues, and I'm like, how? And I'll get to the story of how the point at which I got to know about him was the point he was dealing with his own, and he was helping a whole number of people get through theirs. But before we go into that story, as a mental health professional, was it difficult recognizing that you were struggling?
Well, I think for we mental health professionals or doctors generally, it might be a bit difficult, and I'll tell you why. Mostly, our training has been based on the other people, meaning that we are trained to see how we can manage other people, how we can spot the symptoms from other people, and then we can find those ones easily. When it's happening to us, we would think maybe just normal stress. I remember then when mine started, it was more like, this is just stress now. Maybe I'm okay with it. Maybe it's fine. Maybe with time, if I rest better, maybe if I
Drink
go out
water.
a bit, if I drink, you get. So, I mean, it had to take me like a while, maybe like 2 months for me to now recognize that, okay, this is something sitting down deep, within my heart. So because we are trained to spot other people's symptoms, sometimes when it happens to us, we try to trivialize it a bit and not blow it out of proportion, thinking that we have it under control. I mean, what is it? I mean, we know everything about the human body as well as, the mind. And then we're like, okay, no, it's nothing serious. But then because that blind spot, make us have some certain delays in spotting those symptoms. So it might take a longer while to actually come to terms with it. So it's one of the things that that we experience so much.
I was having a conversation with a couple of friends, and they were like, and I was like, they wanted me to have an appointment on Monday. I was like, sorry, Monday I have an appointment with my psychologist, it's therapy. And they're like, your therapist, who is his own therapist? Like, how do you know that your therapist? It was like, are you sure that your therapist self is okay? How can we prove? And I'm like, wait, I don't think anybody is supposed to listen to everybody's problem. I cannot imagine having to sit down and listen to like 10 people every single day and be okay mentally. So I feel like a psychologist is supposed to have his own psychologist or his own psychiatrist. So I think, do you think that people assume that, professionals, especially doctors or therapists or psychologists or psychiatrists, whatever professional they are somehow immune to anxiety and depression. Like, well, I don't say is it true that you are immune. I say the people think
that way, that we should be immune to it.
Yeah.
To be honest, people think that way. I will not even lie. Let's take it, just far back a bit. I mean, I was sick, and people say, why should a doctor be sick?
As how? Like
why are you having catarrh? Why are you having sore throat? Why are you having fever? How did you get there? So they're wondering that if you are treating other people, you should find yourself always fit, both physically and mentally. So people feel like, if you're a mental health professional or a psychologist or maybe a psychiatrist or in the mental health space, you should not come down with any mental health problems. But I can tell you for free that we're also humans. We're human beings like everybody. So the same thing that affects everybody, the same environment, the same trauma, the same situation, the same circumstances we can find ourselves can also affect us. And definitely we are also prone, also vulnerable to having, those mental health challenges. So of course, why not? We are also vulnerable to having those things.
So speaking about anxiety, because you told me a bit of your anxiety, and we'll go into it if you want to share about it. But what did anxiety look like in your life beyond clinical definitions? Because now this is real life too. This is not just something you read in your book. This is not just something you're applying to people. What did it look like?
Real life. So first off, when I experienced anxiety, it was more like my heart was racing. I can't explain it. My heart was just beating so fast at every point in time. That's number one. Number two, I was just restless. Right? It looked like I have ADHD, like I was having an attention deficit, hyperactive, just everywhere. So I could just be here now in this podcast. And before you know, I'm already downstairs. And before you know, I'm already in church. And before you know, I'm already in the class and I want to go home. I remember when it happened then, if I just come to church and I just look at time, maybe from 8, maybe the 8 a.m. service, by 9 something, I really want to leave. Right, so the anxiety was that way. I was restless, my heart was racing, and in a way to just make people to feel like I was not experiencing it, I will not indulge myself in certain things just to blind them. So what I mean that you not start seeing me, I'll not start working too much. I'll not take my laptop. I say I want to work. What are you doing? I'm working. Call me. I'm working. I don't pick your call. I'm working. Everything is always about work. So I use work to like shield people, and then created that blind spot so they can't easily spot it. But tell me, at that point in time, heart racing, I could not focus for a long time. So if I'm doing something, that's why I said I'll be restless. I move from point A, before I'm already looking at another thing. I'm trying to call people, just distract myself. So distraction, restlessness, heart racing, and not being able to focus on a particular thing was, among the very predominant symptoms I was experiencing.
That experience you shared about using work to just lie. Like, mine was not work. I remember also when I first joined the church, and a lot of people couldn't get through to me, and people could not. You also said that you had that thoughts. So Dr. Ebuka also, this thing I'm saying now, is also a culprit of it. So a lot of people thought that I was proud, and they didn't know that it was just anxiety. Like, the few people, I was talking to just 2 people when I came to Calvary, apart from the person I came in with, and one of the other person knew that I was just struggling with serious anxiety. So immediately after church, I find the person, I say hi, and I move away. And every other person was like, who is this girl? She's proud. You don't know that I cannot I'm not proud. My heart is racing. I don't want to. Don't even say hi to me. I'm walking fast.
Just move fast.
And I think up to now I'm so used to it that when I'm walking on the road, I'm just looking straight. And somebody's like, Precious, oh sorry, I actually did not see you. I'm not avoiding you. I've just become so accustomed to what I had to use as a coping mechanism. I just keep working, and that's why you felt that.
Exactly. I mean, it got to a point that even if you call me, I'm asking, why are you calling me? Like,
and like phone
anxiety, like phone call anxiety. I'm looking at my phone. I'm like, why are you calling me? Why? I'm analyzing the reason why. My postman could call me, and I'm looking like, why is he calling me now? Why did you not call yesterday morning? I'm as beating. I'm like, before I should pick this call, instead of picking the call, I'll allow it to ring for like 2-3 times, and then come back and say, hello sir, please, why are you calling? Can you send a text?
That's so real. Like,
that's
so real. Oh my God, anxiety. I feel like there's some things you cannot just explain until when you actually experience it. So were there moments where you were helping other people emotionally while privately struggling yourself?
That time I was a counselor. I was everything. I was a psychologist, a counselor. I was all out. In fact, I remember helping couples solve their problems. helping someone
That's
with
so ironical
anxiety,
because what?
helping people with, and this was not like mad. These are serious sessions I was having with them. But then I'll come down, I was smiling. Hey, how are you? How are you feeling today? Hope you're getting better. And in my own self, I was drowning in my own, flood. But then it's what it is. Sometimes we're just trained to understand how to manage people. So we might not be totally healthy, but because the way the practice is you already know what you're looking for in the other person, in the symptoms. So you already know how to tackle the problem. So your idea is, I want to tackle and help this person solve this problem, not even considering how you're feeling. But at the long run, if you don't actually attend to your own matters, it's going to affect you and also affect the people you're also attending. So I always tell people, physician or mental health professionals, please attend to yourself first, so you can provide, wholesome therapy to wherever you're.
I hope you are taking that advice.
I'm taking it very much.
Because on this particular question in July, was it July or June that you took that session?
That was July.
Yeah, July 2025, Dr. Ebuka was taking. So thankfully we attend a round, a 360 rounded church, so it's quite balanced. And in July 2025, Dr. Ebuka was taking a session on mental health, and he was standing on the podium, teaching, answering questions. In fact, I asked questions. It was Dr. Ebuka that made me know that my problem is plenty, because I asked him a question, he answered the question, and I asked a follow-up question, and he said, this person, you need to see me. I think your case. I was like, what do you mean by? So that's why I need to look into it. And only for me to discover, I think last month, and he was like, I was dealing with anxiety. So what do you mean you were dealing with anxiety at that point in your life, and you could still do that at that same point?
Well, to be honest, I was dealing with anxiety. I think even mixed with some mild level of depression, if you ask me. And the anxiety came from, number one, I think around that period, first off, I first lost a large amount of money. And then secondly, there was this program I was supposed to do to, progress in my career and all, but then it wasn't forthcoming. So everything looked bleak. I was getting anxious about the future, getting worried. And then I was in this of some relationship.
I was waiting for you to get to that tea.
Definitely. And it even got worse during that period, when I was about to have the whole session. But, I was battling it. In fact, it got to a point when the anxiety was so much that I had to start seeing a psychologist, and a psychologist at one point I might even had to recommend medications for me to take. So even that period I was actually on medications. And with the medication and also the counseling session, it was very helpful that, within 3 to 4 months, I got better, back to my feet, stopped taking medication, stopped even seeing the psychologist, because all of the things you told me to do, sometimes, to be honest, we already know if there are triggers, sometimes just remove those triggers. I mean, if now woman be the trigger, remove the woman from your life first so that you go very see road.
And remove you did. Speaking of depression, because you spoke about depression, I think a lot of people misunderstand depression. And I tell people, I don't want to explain. When people say, are you depressed? I'm like, think of it like this, like I'm in a dark room and I'm trying to reach up. I'm seeing a very faint, ray of light, and I'm trying to reach up, and and every time I get closer, it feels like I fall back again to the ground, and then I keep going, and at a point it looks like I'm locked into a wall, and I can't move, and I just rest, and that's just what depression feels like to me. But most people do not understand. So how does depression differ from sadness in a way that people misunderstand?
Okay, so I'll put it this way. So sadness are momentarily things. So for example, if I'm coming out, someone told me, maybe my car had an issue. I can feel sad because there's an event that made me to feel sad. So, and usually sadness should be fleeting, meaning that it should last it's an ephemeral thing. So it should last for a while, and then with time, you should get better with it. So it's more like an affect. So you're happy because someone sent in 1 million to your account. You're sad because they scammed you 1 million. Right. So it's that way, it's that balance. But the thing about depression that makes it different, in as much as sadness is actually a component of depression. And for depression, we have to call it persistent sadness. Not the short-term ephemeral sadness. So that's one of the components. But then we don't just look at only sadness as the component. We look at every other thing. So number one, we're looking at how was your appetite? Now, has your appetite reduced? Now, probably maybe if you are sexually active, person is no longer interested again. Or maybe you had very interesting activities. Maybe you enjoy playing football, you enjoy watching football, you enjoy going for paddle or games, and suddenly, maybe we'll go play this one. You're no longer interested again. So when those interests start dying, and your mood, okay, so normally we like to grade mood from a scale of 1 to 10. And of course, when we say 1, say that's the lowest form of mood, 10 mean that you're happy. By the time we score mood for people and then explain to them, we'll see that, their mood at most time of the day, maybe around 4, 5, 6. And then, we'll start asking questions of any suicidal ideation. And then when it gets to the point of where there's suicidal ideations, at that point in time, it becomes a major kind of depressive episode. So all those symptoms tied together with persistent sadness now make the definition of depression itself.
Wow.
Yeah.
Makes sense. I think like anybody that listens to this will be able to understand it. I would have loved to go into the several types of depression, but I just want to. I think there is a more persistent issue, and it's in Africa as a whole, which is why we started Stereo, which is why I started Stereo. I remember going through depressive episodes, and I still go through them actually, even though I'm on medications and I see psychologists. But the issue is, I try to reach out for help, in sense that I want to listen to podcasts, I want to listen to sermon, I want to hear people talk. But when I come online, there are people talking about mental health, but they don't look like me. They are whites. It's not a bad thing, but they don't have my struggle, most likely. I mean, they have my struggle mentally, but in terms of location, I can't really relate to what you're talking about. You can't really relate to what. So why do you think that conversations about mental health is destigmatized in Africa? And you now see that a lot of us hold it until it gets to that severe point.
Okay, first off, we have to look at it from, there are not enough safe spaces really for people to pour out their grief or what they are facing. This month we're looking at mental health, we're getting to men, and if you look at the statistics, you see that a lot of men suffer from a lot of this depressive anxiety episode, and the reason is because, imagine a whole full-grown man like me, and then I'm trying to tell someone that I'm sad, or I'm having anxiety. Come on, waiting the word. Some person like you. Come on, that thing, free yourself. So there's no safe space. By the time you're talking to 1 or 2 people are wondering, why. So the safe space is not very, very much available. Secondly, people have spiritualized it a lot.
That's the elephant in the
people have spiritualized a lot. I remember when I first had my first bout of sadness, of depression, and mad anxiety. I remember talking to someone that was, that was spiritual, and the first person was telling that it should not be possible, and started relating to the devil, started bringing a lot of relation to those things. And after I finished and even prayed, I was like, okay, fine. I mean, it seems it's only prayers we're going to do here. I mean, and I understand that the way it works is that the spirit has to be attended to, the soul has to be attended to, and the body has to be attended to. And sometimes to attend to the matter of the mind and the soul, you might need people that are trained, right, to actually help you in those manners. And by the time I started, pointing out my concerns to a psychologist, I felt much better with it. And I knew that, okay, it was not really spirituality. So people have spiritualized it a lot, so people don't want to talk about it. And because mental health issues are vague, unlike normal physical symptoms. I mean, if someone's having malaria, you know that, you have fever, you have headache, you check the person's body is hot, so you can relate
to that
easily with physical symptoms. With mental health symptoms, if I'm telling you that, bro, my heart is beating, you try to imagine it.
You can't.
And tell you that I'm rested, you try to pick it up because it's not very relatable. It's something of the mind. So people are not very in touch with that particular reality. And that makes people not to see how they could help their fellow man. Because if I'm not in touch with your reality, I had someone then, she was in the US and then she was actually battling some mental health struggles. She was going to this foreign therapist and she was always having sessions. And she would call me and say, like, "You're not helping matters."
Ow!
And I feel like if you're seeking therapy, you should seek it in a local context. Because sometimes when you look for people that have experienced what you experienced, and have a level of tribe, religion from where you're from, it becomes easier for you to relate with it. By the time I now recommended her to someone that is in Nigeria and she was having therapists, the improvement she got in the past space of 2
That's
months,
what
she
I'm
could
saying
not
about
compare
this
it.
relatability.
It was
Like,
it had in like 6 months. So you have to look at it in that kind of, like, maybe I feel like if you're struggling mentally, I mean, look for people in Nigeria, Africa that can actually help you rather
Like,
than speaking.
Yeah.
They might have similar approach, but the
But
context might
that's
just
the
be
word,
quite different.
context,
yeah.
yes. Because
Quite
I was like,
different, so,
you know what, if nobody's going to do it, I might just start it, because I need people to be able to come
Mhm.
up and have hope and
Mhm.
say that yes,
Yeah.
these are people. Because I think another issue is because the conversations is not hard enough, we think we are the only ones going through it.
Exactly.
But you will be surprised. Like, out of like 10 people, I think I was running the numbers and I was thinking, I think globally 1 out of 8 people are dealing with mental health issues. 1 out of 8.
No,
How many people we have?
It's-
Billions of people. Yeah, so if we are 8 in this place now, in this set, at least one person is dealing with that's at least. And then you now find out that so many of us are actually going through this, and people are not just talking.
Yeah. And the thing is, people have like what you call functional depression. When I was working in a hospital, what I did was I did a survey. And that survey was, okay, I saw people happy, people smiling. I was like, let's see what's even beneath this mask. People can put up a show at work, they're active. In fact, we give them tasks, they do it. And by the time I did a survey and we passed it all across, I think at that point in time, we had about maybe 20 something staffs. At that point in time, we found out that about 15 of them were having one mental health problem or the other. Some were already suffering from depression. And those people that are suffering from the depression itself were actually the most active and happiest people in the workspace.
Always.
That's how it always works.
Yeah.
So sometimes they can mask it by being functional with what they're doing, but then deep down, seated within, I'm telling you that they're going through a lot.
Now that we've got into functional depression, just takes me right into my next question. So how do I performing or strong people, how do you think they sometimes hide anxiety and depression? So just like you said, behind productivity and business. Because I think for me, while I was working 9 to 5, as at last year, I didn't even know that my problem has gotten deep until when I left the sector, and then I had to sit still with myself. I was like, okay, I can't even sit still with myself. And that's when I realized, oh, you're just an high-performing individual that has just been moving. I'm just moving, and I cannot be still. So how do you think that we hide this anxiety and depression behind productivity and functionality?
Yeah, so as I said, in that study, among the people that actually had that functional depression were mostly among men. Right, men, and I can tell you there was this book I read. I don't know if you know about, where they say women are spaghetti and men are like thinking cones. So usually for a woman, once a part of her life is affected, to an extent, it can affect every other part. For a man, he can actively distinguish this from this. So a man can actually distinguish that this is work. And this is another thing. And that's why men don't do multitasking easily compared to a woman. A woman, you can make a woman sad now, and every other thing she's doing, when she's cooking, she's sad already. When she's working, she's sad. Leave me alone, I'm not just in the mood. A man will be like, okay, I can separate work and separate it from every other thing. When I'm having my lonely period, I can now feel that sadness. When I'm working, I just try to put my mind to it. So the truth is, people mask depression or anxiety or any mental health problem because they don't want to be judged. They don't want people to come and look them less. Let me put it in that way. So in that way, they still want to be high performing. They want to be happy. They want to be indulging in their work. They want to be doing things that make people. It's a performance to make people to believe that I am okay. I don't need your self-pity. So
I know, right?
When it gets to self-pity, people don't like it. So
people refuse help so much.
And imagine you're working, this guy is so cute and strong and he's suffering.
But why do you think people refuse it? Because I find it annoying. Like, you are trying to help and people refuse help over and over. Is it an African thing or is it general thing? Because
it's general, actually.
It's general. Are you sure?
General.
Yeah, because I was starting to think it's an African thing because we have a whole lot of things.
Because people have not come to realization that I don't actually suffer from this mental health problem, which you call lack of insight. So until you have insight to matters and know that truly you do need help, That's when you now start seeking help. But when you're still having lack of insight, when you feel like I'm okay, I have no problem, I think I can manage it. I think this, some people, that what you call acute stress reaction. Some people just think it's just an acute stress reaction that lasts for like weeks, but then it's lingering for a long time and it's affecting you as an individual. And you ought to seek help, but you decide not to seek help. So until you come to that point that, okay, I think I have insight of what is happening to me, and the next step for me is to seek help. Right. And as I said, for a masculine nature, and I'll speak for that because most times we don't like to seek help, even for physical health conditions. That's why I see when it comes to maybe issues in the hospital, a man will present late to the hospital, a woman will present earlier to the hospital because they prioritize their health. But men be like, no, I feel manage this one.
Man, I think we need to deconstruct that. Mama, you be in this. Like, we need to deconstruct it. I don't want to hear it again.
I love layers. Don't worry. It's plenty. It's plenty.
Did your personal experience with anxiety and depression change the way that you approach patients?
Oh, very, very much. Because, there's a difference between I read something in the text. There's a textbook knowledge, right? Which is vital to help to understand. And there's an experiential knowledge. And then when it comes to the point of you experiencing something, it makes you to now treat people much more differently. So for example, someone comes to me and a person is having anxiety. Normally, if you see a good number of doctors, and they know what I'm saying, the person just comes and say, I'm anxiety. And I say, anxiety, when did this start? Just gonna buy this medication and go. They don't really have the time to really be with you, to be empathetically available for you, to have that sympathy. They're just like, okay, just gonna buy this medication and refer it to psychologist as well. But someone that has gone through it, like I've experienced some of these things, it makes me to relax a bit, sit with the person, try to explore this person's emotions, try to see how I can help you. And most times you see that by the time you now discuss your experience, it might not be very detailed, but just tell them, I've experienced it before and I've come out of it. It makes them feel safe. Makes them feel relaxed, make them feel that you're going to be non-judgmental to them. And you see that, with time, there'll be a much response, in those set of individuals than people that just speak textbook, experience.
This makes a lot of sense because I know that, coming into psychology and then I had to go through assessment. I think I did about 2 assessments or so. And then both came out as severe depression. And my psychologist did not take me for any medication until like a month and a week into. I think that was like his last resort. Like, I feel like he wanted to explore anything and everything before putting me on medications. And like, medication is like the last thing. Okay, at this point, I think you actually do. So I think I'm lucky that I did not experience those people that you just come and immediately, severe depression, just take it out. So finally, to wrap it up, many people struggle silently because they fear judgment, they fear spiritual shame or paranoia. How do you think that we can begin creating safer spaces for people to talk?
I think that's why still here, right? I think that's one of the reasons why you had to open that. I must really commend you, for this. I think with this and people sharing their experience, it makes people to be much more in tune, with their emotions and how they can reach out. So I feel podcasts like this that are streamlined to people experiences about mental health struggles, not just the mental health struggles, how they're able to come out of it, can help people to shed more light on how they can tackle their situation. So podcasts like this are very helpful, so I must commend you. Secondly, I feel like in a country like Nigeria, we've not had proper linkage to mental health support.
We're even so underreported.
Mental health support is very, very poor. I was in Abuja some months ago and there was this woman I went to see for home treatment. And when I went to see her, by the time I looked at all of it, apart from the fact, that a physical illness can actually result in mental health problems. Right? And then mental health problems can also result in physical problems. So this woman had a physical illness, and by the time I started talking with her, I found out that she has issues with her mental health. In fact, she was already depressed. But the problem she had is that, the hospital she's going to, they said there's no psychologist there's nobody, she has to go to one place and all of those stuff. What I just did was very simple because I had a number of psychologists. I thought that, you can be at Abuja and then you'll be having a virtual session with someone that is in Lagos. And so she didn't know that there was something like that. So a lot of people don't know how to assess. So the proper linkage to care is not there. There are different between, there are counselors and there are psychologists. So you have to differentiate them. Psychologists are people that are well trained or more trained for this. Counselors can just give you general advice, which is not bad. They work hand in hand. But then when I say linkage to psychological treatment or a talking therapist, as it's been called, we don't have that yet. Yes, I mean, there are a lot of apps that are focused on people that have prostate, people that have breast cancer, but you see that, there are not a lot of linkage. And until we get to that point where people from the dial of their phone can have access to those care rather than even walking to, because some of them don't like to walk to a hospital. Looking at somebody and saying, I have anxiety, I have depression. And they're just like, oh, you're somewhere there, we're not seeing your face. I'm in another place, I'm seeing your face. How can we have that? And then I think the church too also has a role to play. In the sense that, in as much that, yes, there is a subpath of things that can have to do with your mental health that is spiritual. But I can tell you that a good number of it are not also spiritual. And if the church can also have programs to enlighten people, one, that, okay, let there be some level of mental health awareness, and not just enlighten them, see how they can also effectively link them to care and support. I can tell you that the church, as well as the world, will also be a better place.
Wow. I don't want the conversation to end. I think we would have to, we definitely do have to make you, because you need to go in depth into a lot of things. And I know I said finally before, but I just feel led to ask you, do you have any final words? Anything you just want to share? Generally, probably to somebody watching, a doctor, anybody at all, anything random that comes to your head that you just want to share.
Okay. All right. So first off, I want to let everybody know that your mental health struggle is not just peculiar to only you. Right? A lot of people are also experiencing this. And I can tell you that it will not be nice at the end of the day that you're experiencing this alone and you don't have someone or someone that you're talking to. When I mean that someone you're talking to, you're not seeking professional help. And I'll be emphasizing on professional. Not people that will just say, Kwele, you'll be fine, don't worry, the future is bright, there is light at the end of the tunnel. Those are just motivational speeches. There are people that are trained for this. And I feel like if we're ready, we can set up a proper network, right? And link people to where they can receive professional health care. Until you start receiving professional health care, when you're experiencing these struggles with your mental health, be it anxiety, be it depression, be it any of those forms, right? At that point in time, you know that you're one step away to freedom. So I advise everyone, reach out to your profession, to your healthcare workers, reach out to your mental health therapist. And if you're also struggling, you can reach out to Still Here Podcast, and then we can be able to link you up.
Yes, we'll link you up to Dr. Ebuka.
There's plenty on my table like this.
Or even if he doesn't have your time, we'll push it for you. If it doesn't make time for you, we'll link you to someone else. But thank you so much.
Free?
It's not free. Is it free?
I don't know.
Maybe you want to give us a little bit of incentive. Like, I mean, anybody's coming from Still Here, just something
I'll
small.
Talk to God in prayers. I will speak to him.
Thank you so much, Doctor. This was such an insightful episode. Like, I am, the way you just broke everything down for everybody to understand. And that's the point, for every single person to be able to understand that this is real. And the fact that you can't see it, you can't touch it, doesn't mean that it's not affecting you or it's not affecting your neighbor. So thank you very much for sticking with us. Also, once again, please do well to follow us on all our social media platform at sh.podcast with a double T on Instagram and on TikTok. And big thank you to our sponsor, writer Olik. This amazing t-shirt and our placard is yours truly from him. And thank you so much for sponsoring this episode. And once again, you're still here, and that is more than enough for now.